so when I would enter my room, I would perform hand hygiene, provide my patient with privacy and comfort, and then I would perform my general assessment, and then I would go into doing my cardiac and PV assessment. So is it okay that I'll be touching you for this assessment?
Yes.
Okay, so to start off, if I was in a hospital, I would have my patient take off her shirt to assess her chest for any lesions or scarring or abnormalities, but for the sake of this video, I will have her keep her shirt on. So the first thing I will do is palpate her chest, and so I will do it in 5 regions, first starting with my aortic region, then my pulmonary, then my herb region, my tricuspid, and my mitral. So next I'm going to listen in those regions as well. So starting in the S1 region, my S2, the herb, my tricuspid, and my mitral, which is also known as the PMI. And now I would normally listen to the PMI for 60 seconds, but again, for the sake of this video, I will not be. So after listening, I don't hear any murmurs, and so everything sounds within normal limits. And so next, I will listen with my bell side, starting in the mitral, tricuspid, herb, S2, and S1. Okay, so once again, everything sounds within normal limits and I don't hear any murmurs. So next, I'll be moving to my carotid artery. So I will first just check and see and make sure everything looks normal. Then I will palpate. Any pain?
No.
All right. Then one at a time, I will feel for her pulse. And then with my bell side again, I'm going to listen for any bruise. All right, so after listening, everything sounds within normal limits and I don't hear any bruise. So next I'm going to move on to assessing your skin. So first I will palpate for temperature, which she is warm, and moisture, she's dry. Then I will check her capillary refill. Which returns within 3 seconds, which is normal. And I will also check for edema, which she doesn't have. And then I will check her radial pulses at the same time. And they feel symmetrical, which they are supposed to, and then I will check her brachial pulse, which again feels symmetrical. So next I will move on to the lower extremities, again assessing for temperature, she's warm, moisture, she's dry, edema, not present, and then I will check for her capillary refill in her toes, once again return within 3 seconds. Then I will check the pulses for her posterior tibia, and her dorsalis pedis. All right, and with that concludes my heart and PV assessment. Do you have any questions?
No.